Indian music therapy is a system in which the physical, mental, intellectual, and spiritual well being of all things, all living things, not only of human beings, is considered. And it incorporates the Vedic traditions as well as the regional musical traditions of the land. Hence, integrating any indigenous medical practice with research protocols of modern medicine becomes easy and with sound theoretical as well as practical basis. Now, Indian music has its base on two sciences. One is the Dosha Siddhanta of Ayurveda, and the other is the Shabda Shastra. Shabda Shastra and Tridosha Siddhanta, Triguna, Tridosha, these things are essential for all the Indian systems of philosophies and sciences. And this is also based on the Nadalaya Yoga or Nadanusandhana Yoga of Pranava, which is used not only by the Samavedins but also by the yoga people, Patanjali Yoga. Patanjali Yoga is very popular not only in India but also in abroad. So Indian music is using the sound, that is the science of sound, the science of Tridosha of Ayurveda, and also that of yoga. Now, because another fact is that almost all the medical practitioners, not all, but majority of the medical practitioners who practice Western medicine, they love music. That is, from my own experience, I can vouchsafe that. Most of the medical practitioners love music, and music is very popular among them, among Indian doctors. Most of them sing or they play some instrument or something like that. What one has to do is then use this integrating golden link for uniting the indigenous as well as the modern medicine people. So it is not that, it's not a difficult thing, I think, because, take away all the other criticisms, all this and that, hatred speeches, etc. You just think those Western medical doctors who love music, they will definitely try to use music to get the well-being for their patients, their own clients. So what one has to do is all the differences of opinions existing in the theoretical and practical integration of healthcare can be removed by the use of music in the therapy sessions. So we can do that actually. I don't think that it is a difficult thing because most of the doctors love music better than their profession. So not very difficult. And how music works, the music therapists use Swara or Raga. Raga for the classical singers, for both Hindustani and South Indian classicals. But Swara is used by all singers, whether it is Deshi or Margi or whatever. And Swara is actually used as both Dravya and Adravya. Dravya means matter, Adravya energy. Swara has both qualities and it is used as Dravya and Adravya for healing. And therefore, both biomedical as well as what you call the astrophysical or energy level of healing are employed by this Swara, by the sound. And this is the crux of its universal use as an integrating medium. Now, the pictures and all I cannot show it here. We have to look into the books. Anyway, Swara as Dravya is measured by its length and height and volume as well as the time. Still is invisible to the eye. You can't see the Swara, but still it has a length, a height and a volume. So it is considered as a Dravya. Shabda or sound has the quality of Akasha among the 5 elements. The Akasha or the space-time continuum. And it has got only Ega Guna. Akasha has got only Ega Guna. And that is why Akasha and the sound Om symbol is considered as the symbol of God. So sound, the Swara, sound, God, Akasha, Omkara, all these can be experienced. But you cannot see that by your naked eye. In this way, since you cannot see it, it is an Adravya. Since even though it is unseen, it has got certain like height, volume, length, etc. These things, you call it as a Dravya also. So it is simultaneously Dravya and Adravya in definition. Then music use principles of chakra energy in our cosmic as well as in our biological bioenergy field. Nada or sound and Laya Yoga, that is merging in sound in your samadhi, is the function by which music heals us. And in India there are 3 types of charyas. Charya means your day-to-day activities. One is dinacharya, day-to-day activities, the 24-hour cycle. Then there is a Rithucharya. There are 6 seasons. 2 months make 1 season. Like that, 6 seasons. Then the Yogacharya. That is based on our chakras, Shat chakras. That is the 72 Melakarta Raga. So the day-to-day activities, the time is divided into 24 hours in which the morning raga, every prahar has got its own ragas. This is used in the North Indian classical music. 24-hour division and giving ragas to each. That is a day-to-day activity, dinacharya. That is used by North Indian music. And Rithucharya, only 6 ragas are there. Now these 6 ragas for 2 months each, that is 6 ritus for the 6 ritus. Then depending upon the chakras, we have the Mela Chakra Raga, that is the basic of all ragas. Now in the Rudu ragas, in the Vasanta season, you have to give Vasanta Raga. Like that, In the Grishma, you have to give Sri Raga. Then in the Varsha, Malhari Raga. Then Sharat Raga, the Kannada Raga. And Hemanta, you give Sintala Raga. And Shishira, you give Malava Raga. So these are the 6 Rudu Ragas. But in the other thing, that is the Yogacharya, that is the Melakarta Raga, we are differentiating it from the viewpoint of the Shat chakras, left side and right side. On the one side you get the usual ragas, the other side you have the Pradimadhyama ragas. Like that, 2 sides and 36 ragas on each side. Like that. Actually speaking, if there are any disease processes in the Anahata chakra, that is the heart area, heart, lungs, like that, that area, if there is a disease, you use the ragas prescribed for Anahata chakra. Like that, from Muladhara up to the Vishuddhi, we have got ragas. And so we have to use that in depending upon the organ affected. So in each and every department, the doctors can tell which organ is affected. But the other thing, the ragas for this area, that is the brain area, that is for the nervous system. The brain and the top of the central nervous system, those ragas can be given for all patients because all these are concentrated here. In that way, you can prescribe a few ragas for you, all of your patients. Depending upon the chakra ragas, give the Malagartha, select the Malagartha. Then, depending upon the Ritu, you select the 6 ragas to rotate. And day to day, you can, the time period when the patient listens to music, at that time, whichever raga is needed, you can select those ragas. Plus, you can also select a few ragas which is the choice of the client itself. Because only then they will get an interest in listening. So like that you can choose the ragas and give. And suppose the client is not interested in music, they may be definitely interested in something else like poetry. I gave poetry to my Mariamma. She loves poetry, not music. So you can give that. So there is no harm in giving any type of music, any type of poetry recital, anything. So it's a client-oriented thing, not a doctor-oriented thing. You don't have to go with hard and fast rules. Suppose a patient loves something, you can add that. Along with that, you also add the chakra music, etc. also. That is for our in the health reasons. Anyway, these chakras are universal. You know, our nerve system, what these people call as Kundalini, the Kundalini chakra, then this only our nervous system. They call what they call chakra or Padma. These things are our plexuses, heart plexus, the cervical plexus, sacral plexus, all these things. Then this Ajna is the here. See, our nervous system only, nothing else. And so energizing it means only energizing our nervous system. And improving our immunity. When you use the beautiful ragas which the patient like, how they respond to it and all, something called endorphin is secreted in their brains. Their immunity is better, their pain and stress, everything is reduced. In this way, it will help you yourself to improve your professional practice. You will be honored by the clients better than you are giving this something chemical alone. Whenever you start giving chemicals, you become very mechanical. Whereas this one, there will be rapport between you and your client. That client will be, from the client's point of view, this interdisciplinary, integrated, result-oriented approach. It integrates the doctor's and client's point of view. Yet it is client-centered. There are no side effects for music. Suppose you use current or the sound decibels you use are correct. If you go up, it will not be, it may cause. So you have to know something regarding the levels which you can, your ears can accept the sound. So the the underlying science, the philosophy and integrative power for healing purposes in case of music is really very good. And the concept of nadi and chakra, both in the Indian and Chinese medicine, would be the most fascinating and worthwhile research topic, and according to Mark Forshaw, Anna Weinbush and Tina Cartwright. Actually speaking, with my medical training and my love of music, my love for philosophy, astronomy and yoga, my journey had it has been intensely fascinating with the music therapy practice and experiences that I got from it. And the principle of Ayurveda, principle of yoga, the principle of sound, and a cost-effective procedure which will reduce the dosages that you give, which will reduce the duration of hospital stay for surgery. That also is important because for a majority of people of India, the exorbitant cost rates in a super speciality hospital also can be reduced. So approachable to the poor and middle classes and very pleasant with no side effects and very cost effective. Now Swara with Triguna, a balanced Triguna, increase psychosomatic balance and immunity. The balancing is done by time, seasons, day, night, and cosmic and bioenergy harnessed for balancing life. It combines a spiritual tradition with science, Ayurveda, Jyotisha Shastra, and medical knowledge. All these are combined when you use music therapy. So both science and arts, the East and the West, are integrated by using this method. Follow the principle of documentation and evidence-based practice and research tools and protocols, and evaluate the ongoing projects. Have an open outlook for growth of the discipline. Statistical evidence and data compilation from various centers should follow as a meta-science. Now, about the use of hospital-based protocols and proof for evidence from the hospitals is an important part of any music therapy education program or research programs. And I find that many of the so-called music therapy education courses do not have this hospital-based program. My idea is that that type of thing is not going to help anyone. And also, this is music. That music is not a drug. Some of the musicians say that this raga is for this disease, this raga is for this. That is not possible in music therapy. That I will tell them. It is not like a drug, crossing for this thing. It is not like that. That principle is not there in music therapy. There are individualistic variations, there are chakra variations depending upon the dosha levels, etc. That is why those different musics has to be selected according to the patient's or client's likes, then according to the day-to-day cycle, according to the seasonal cycle, according to the chakras involved in the disease. Now, these things has to be done only with a combined effect. That is a medical doctor, that is a Western medicine practicing doctor, and a hospital system is absolutely essential for that. Yeah, under them, under a hospital or in a small center, even up to primary health center, they can help. These people the musicians who have got a awareness for how to do this therapy, we are trying to have that type of faculties, developing that type of faculties. Now, those people has to work in unison with the hospitals. Then only it will become useful for the healthcare system. So that is what I envisage, or I envisaged. So music therapy is good for all of us. We are at the same time doctors as well as clients.